Hello everyone and welcome to Boundless Dentistry. In this video, we'll talk about cluster headaches. Now, we'll talk about everything that you need to know about cluster headache, starting off with introduction, etiology, pathogenesis, and then finally we'll talk about how do we actually treat cluster headaches. So let's get started. Now, cluster headache basically is a neurological disorder in which patient experiences severe episodes of recurrent headaches. Now, an important feature about cluster headache is that it is usually located on one side of the face, around the eye specifically. That's why it is called as unilateral headache. It only affects one side of the face. It doesn't affect the other side of the face, which is an important feature about cluster headache. Now, pain that the patient suffer from in this cluster headache basically disturbs their sleep, and patient mainly complain about pain around the area, and there's lacrimation. It means that there is watery eyes as well. So these are certain important and basic features about cluster headaches. Now, if we talk about etiology of cluster headaches, basically there's not one particular etiology that's directly associated with cluster headache. However, there are different factors which are associated. The most commonly associated factor for cluster headaches is vascular theory. Other than that, we have genetics, smoking, drugs, and hypothalamus abnormalities. So, vascular theory is the most important and common etiological factor that leads to cluster headaches. Other than that, there are other associated factors as well. Now, if we talk about the different types of cluster headaches, mainly we have two types of cluster headaches. Firstly is the episodic cluster headaches, where it happens in groups. The episode of cluster headache may last from 7 days to a year, and each episode's duration may be from 15 minutes to 3 hours. Now, patients take medicine, and this medicine basically decreases the duration of each episode. The second type of cluster headache is chronic cluster headaches, where the headaches are regular and it may continue for a year or even longer. So we have two types of cluster headaches. Firstly, we have episodic cluster headaches, and then we have chronic cluster headaches. Now, if we talk about pathogenesis of cluster headache, this pathogenesis is quite important because it actually explains how cluster headache is occurring. So firstly, we have trigeminal-vascular activation, which is called as CGRP, where there is activation of trigeminal vascular system, which leads to release of trigeminal vascular neuropeptides, substance P, and calcitonin gene related peptides. So these two proteins, they are basically released, and that leads to neurogenic inflammation, and that leads to dilation of dural blood vessel, which actually leads to pain. So this is the first proposed theory for pathogenesis of cluster headaches. Now, the second theory that we have for cluster headache is cranioparasympathetic activation. Now, in this case, we have activation of cranioparasympathetic fibers. This leads to impaired vasomotor and secretomotor innervation to the cerebral blood flow, the blood flow to the brain, and lacrimal glands and nasal mucosal glands. So these are those glands which are actually responsible for causing the symptoms of cluster headache, which eventually leads to the symptoms that the patient complains with. The third theory, that is internal carotid artery dilation, where the dilation actually obstructs the cavernous sinus and then leads to pain and autonomic features of cluster headache. So these three theories have been proposed as pathogenesis for causing cluster headaches. Now, if we talk about the signs and symptoms of cluster headache, firstly, patient has excruciating pain around their eye unilaterally, as you can see in this diagrammatic picture as well. Next, that pain may radiate to the neck and shoulder and scalp of the patient. Patient may experience restlessness and also excessive tearing in one eye, where the pain is actually been experienced. Other than that, patient may complain of stuffy and runny nose, facial sweating, swelling around one eye can also be experienced, and drooping of the eyelid, which is associated. So As you can see, the features are mainly associated on the affected side of the head, that is unilaterally only. So these are certain important signs and symptoms that you should note in order to reach a clinical diagnosis of cluster headaches. Now, if we talk about the cluster period characteristics, firstly, it may last from around 6 to 12 weeks generally, and the start and end date of every period is quite consistent or may not be consistent, but in most times it is consistent. Now, people experience the episodic cluster headaches with some period of remission in between where there will be no symptoms. Now, the chronic cluster headache that the patient might experience may continue for more than 1 year now. The headache is usually occurs every day for such patients. Rarely there are some times where the episodes may not occur every day now. As we discussed before, the single duration of attack may vary from 15 minutes to 3 hours now. Attack time of each episode is almost same on every day. Most of the time when this attack happens at night, it basically wakes up the patient, and that is quite troublesome for the patient. And lastly, the pain usually ends all of a sudden. So these are certain characteristics of cluster headache that you should know, which actually helps us to reach a diagnosis of cluster headaches. Now, we talk about how do we actually reach a diagnosis of cluster headache. Firstly, there is international classification of headache disorder where at least 5 criteria has to be met in order to reach a diagnosis of cluster headache. Firstly, there is severe unilateral orbital and or temporal pain which is lasting for 15 to 180 minutes if it's not treated. So that is the first indication of cluster headache. Second is that the headache must be accompanied by red eye or tearing on the side of headache that we've discussed as sign and symptom. Other than that, patients should experience nasal congestion and runny nose on the side of headache. Next, eyelid swelling on the side of headache, facial sweating on the side of headache, eyelid drooping on the side of headache, sense of restlessness, the attack frequency every day or 8 attacks per day. So this is the classification proposed by International Classification of Headache Disorder, where any of the 5 criteria have to be met in order to reach a diagnosis of cluster headaches. Now, lastly, let's talk about the treatment of cluster headache. Firstly, talking about episodic type of cluster headache, oxygen may be given to the patient for around 12 to 15 liters per minute for 15 to 20 minutes. That helps with the symptoms of the patient. You can also go for sumatriptan 6 mg subcutaneously. You can go for zolmitriptan 20 mg as a nasal spray. You can go for lidocaine 1 ml 10% solution applied bilaterally. Octreotide also 100 mg subcutaneously. Ergotamine 2 mg sublingually. Now, if you want to prevent from the episode of cluster headache occurring, you can go for verapamil 250 mg orally max dose. We should not exceed dose greater than that. We can also go for steroids, oral prednisolone, which can be given to the patient and actually helps to prevent the episode from occurring. And then lastly, we can also go for valproic acid 600 to 2000 mg per day. So this is the treatment of episodic cluster headaches. Now, if we talk about chronic cluster headache treatment, we can go for verapamil 240 mg max dose orally. We can go for lithium 800 to 900 mg with meals. And lastly, in refractory cases where none of the treatment is working for the patient, then we go for deep brain stimulation to treat the patient. So in this video, we talked about everything that you need to know about cluster headache, starting from with what actually is cluster headache, etiology, pathogenesis, characteristics of cluster headaches, signs and symptoms, diagnosis, and then lastly we talked about the treatment of cluster headache. So I hope this video was useful for you, and if you like this video, please like, share, subscribe, and press the bell icon. Thank you for watching this video. See you next time.